is that there are 2 new cases of Covid-19 to report in managed isolation in New Zealand, and we also have 1 historic case to report. So our total number of cases is 3 today in the community. So one of the cases today arrived from Ireland via Dubai on the 29th of September. The person has been in managed isolation at the Sedima Hotel in Rotorua and tested positive after developing symptoms around day 8 of their stay. They've now been transferred to the Auckland quarantine facility. Second case reported today arrived from Hong Kong on the 3rd of October. The person has been in managed isolation at the Holiday Inn in Auckland and has been transferred to the Auckland quarantine facility on returning a positive test from their routine day 3 test. Now that third case, which is an historic case, is regarded as an older infection where the person has not been actually infectious while in New Zealand. This person arrived from India on the 27th of August, routine tests around day 3 and 12 while in managed isolation, and completed managed isolation on September the 11th. The person was retested as part of the follow-up to the Christchurch returnee group of cases we had, and returned then a weekly positive result. We have seen these before, and I've explained how we're going to treat these cases as historic cases. We just had to confirm with our counterparts in India that this person had not been recorded and reported as a case there. The person hadn't been, so we have now recorded this person as a case and will report it to the World Health Organization. I should say the person was in self-isolation as a precaution anyway while that investigation was undertaken. So our total number of cases confirmed in New Zealand is now 1,508. 1 further case is now considered to have recovered, so our number of active cases is 39. These are all imported cases, and there are no community cases that are active at the moment, as was announced yesterday afternoon. I think that's a great milestone. We have 1 person who remains on the ward in Middlemore Hospital with Covid-19 today. So, with those numbers I've just reported, and as Auckland has now joined the rest of New Zealand at alert level 1 today, it's worth reflecting on our collective success once again in responding to an outbreak, the Auckland August outbreak. And it is a very good time to remind all New Zealanders we need to remain vigilant to the risk of this virus re-emerging. One doesn't have to look far offshore to see that it is a very real and present danger and threat, and increasing threat in many countries. While the source of the Auckland August cluster remains under investigation, we continue to do so. We may, however, never know exactly how that cluster arose. There is still an ongoing risk further cases will emerge in the community, and our key point here is alert level 1 is not alert level none. So we need to stay alert and play our part. Any future cases we need to identify quickly. We need to get people into self-isolation and find close contacts, something we have done once again successfully, get these people tested and avoid the virus spreading unimpeded in our communities. The way to do this is simple. Most importantly, if you are unwell, stay home and seek advice and get a test. Please continue to keep a record, and there's an easy way to do that with the NZ COVID Tracer app on your phone. Please keep using it. We have seen a drop-off in people scanning. Businesses are still required to display the QR code. We have and will continue to remind them of that obligation, and we're asking them to make sure the code is prominent so it is easy for people to continue to scan. The use of that information was very much an important part of our response to the Auckland August cluster, and in particular the cases that travelled to Taupo and then resulted in an additional little group of cases that we followed up. I do want to continue to encourage people to use masks wherever you are on public transport and on flights. It's not compulsory, but I would recommend it, and I will be doing so myself. Please maintain physical distancing where appropriate and where possible, and of course keep going on the stringent hygiene measures, including washing your hands and of course good cough and sneeze etiquette. We will have a role to play, as we do in managing the outbreak. We have a role to play in preventing the next one, so please do play your part. We have done well to date by acting together. We will continue to do well if we all continue to act together. Now, we are getting close to the milestone of 1 million COVID-19 tests in New Zealand, since they started it right at the end of January, which seems a lifetime ago, but was just earlier in 2020. As part of our assurance around this figure, we have done some checking of all the data and identified that there were some duplicate test counts, around 1% of the total. It came about where a test might be reported immediately on a day, and then as part of ongoing quality assurance was updated on a subsequent day, and a small number of tests were counted twice. So as a result of that assurance process, the revised total number of tests processed to date is 986,544. So we're not far off the 1 million, but we want to make sure when we mark that milestone that we have truly achieved it. I should say yesterday our laboratories completed 6,152 tests. Today we are publishing a report on COVID-19 among healthcare and support workers in New Zealand, and that was those who had developed COVID-19 infection up to the 12th of June, so during that first wave of infections in New Zealand. They made up approximately 11% of our total number of confirmed and probable cases in that first wave. Globally, the WHO has reported around 14% of COVID cases being healthcare workers, and in some countries this has been as high as 35%. That report will be available on our website. We had a total of 167 COVID-19 cases among healthcare and support workers. The report outlines that 96 of those, 57%, were likely to have been infected in the workplace. The remainder through overseas travel, and they returned to New Zealand, or they were infected in the community. The majority of those infected in the workplace were part of relevant clusters. Of those health and support workers infected in the workplace, 62.5% worked in aged residential care, so nearly 2/3, while 27% worked in a hospital and 10.4% worked in other community settings other than aged residential care. Now, while the proportion of our healthcare workers as the proportion of total cases is lower than in other countries, the report reinforces the importance of work that is needed to protect these workers and the people they work, live and interact with in their communities. We have continued to work closely with a range of providers, particularly aged residential care, to strengthen protection for these workers and their contacts as part of our overall response. And I did a quick review this morning. My assessment is that in this latest Auckland outbreak, we had just 3 healthcare workers infected, and one, it's unclear that that person was infected at work, so it may well have happened in the community. But the 2 that we are clear about, learn from those events and continue to put in place measures to protect our important healthcare workforce. Finally, I'm going to give a bit of a plug for measles immunisation. We are now kicking off our wider, or restarting our wider measles immunisation effort to vaccinate 15 to 30-year-olds who have lower vaccination rates for measles than the rest of the population, for reasons that you may well know. COVID-19 has highlighted the importance of protecting our communities and our whānau and our children against vaccine-preventable diseases. And whilst we can't vaccinate yet against COVID-19, but there is obviously a tremendous amount of work underway to get us in that position, we can protect ourselves from other very, very important and real infectious diseases. Measles continues to be a problem globally. We have been measles-free since late last year, and we want to stay that way, and this catch-up campaign for 15 to 30-year-olds is absolutely important about that. Pointing out, a reminder that measles is actually about 8 times more contagious than COVID-19, and last year's outbreak is a reminder of how quickly it can spread amongst unimmunised people. So anyone aged 15 to 13 who isn't sure if they have been immunised should seek a vaccination from their doctor or pharmacist free of charge. Remember that the schedule for measles is for 2 vaccinations, so even if people have had one, the second one is also important. And also the national immunisation schedule. Continuing to progress the work on the COVID aspect of that we're responsible for of the Ministry of Health, working closely with the Department of Internal Affairs as a community trial in an area around the Rotorua.
And so when is that going to kick off?
I don't know the exact date of when that's going to kick off. I'd have to check that.
So the trial hasn't started yet in Rotorua?
I just have to check, yes. Yeah.
How much is a success is it to have all of New Zealand at level 1?
Oh, look, it's a huge success. We cannot afford to be complacent, of course, I must say that, but we should pause and recognise that it has not been without its challenges or its costs, but it is a great point to be in. And the key point here is it gives us all some certainty. We're all in alert level 1 now. It allows us to now take options about what we can do. And if we look overseas, we can see that we are in a much better position than many countries.
Are masks still being encouraged on public transport?
Yes, I'm definitely encouraging people to keep using them on public transport. We've got used to doing it under alert level 2, and likewise on flights. And it's just, I think it's a helpful thing for people to do.
What's your message to New Zealanders around complacency?
My message to New Zealanders is please do not be complacent. Again, to our little hopefully soundbite of the day, alert level 1 is not alert level none. It even rhymes. So that was written for me, that one. But this is the point. Look at the UK. We look at most of Europe. We look at the USA. These are high income, there are many high income countries that are really challenged with dealing with this virus, and the impact on the health of their citizens, their healthcare system and their economy is absolutely significant, and I think we've put ourselves in this position. Let's not give away the gains we've made.
There was a story around this morning of a woman in the Rotorua managed isolation who, for medical reasons, shouldn't have a nasal swab. Should she be allowed to have a throat swab?
But what I will say on that is I know that the local medical officer of health is very experienced, and that person will have the full clinical picture, and so I would be absolutely deferring to their clinical judgment. We've had a conversation with the medical officer of health just to understand things a bit better, make sure that he's got all the information he needs.
What's your advice then? Should we allow her to have a throat swab, or are they pointless?
Again, I think it's not for me to second guess the clinical judgment of the local doctor, who will know what the full picture is.
Do we need to just keep people who have additional concerns in for 22 days rather than the 14 to rule it out if they can't have a throat swab?
Sometimes people actively refuse to have any swab, and then the medical officer of health will keep them in for a period until they are judged to be low risk beyond the 14 days. But again, in this particular situation, we've got many thousands of people in our facilities at the moment, and we've had well over 50,000 that have come through, and the local medical officers of health are best placed to make decisions about those sorts of clinical issues.
Have you had lots of people that have refused tests and been kept in isolation longer?
I don't know the number, but it's not very many.
Do you have any messages for Wellingtonians ahead of this weekend? There's quite a big events weekend coming up. We've got the rugby and concerts. It's going to be quite busy. Any COVID-related messages?
Well, the first thing to do this, of course, that we can play the 2 Gleaders Low Cup tests this weekend and the following weekend up in Tamaki Makaurau is because of the work we have put in. So it's great to be in this position. However, just going back to those key messages earlier on, please do scan in. If you've got symptoms, I know it might be a pain, but give your ticket away to the Gleaders Low Cup match. I don't need it because I've managed to secure a not very good seat, but it's a seat. But yeah, look, let's just not give away these gains. Don't go if you're unwell, and if you are unwell, get that test done. And just, I know there's going to be some extra effort about having hand sanitizer there. Just be sensible.
And just finally, could masks still be made compulsory in some areas, even under alert level 1?
Well, it's one of the ones we will look at. We're always looking at the settings. At this point, they're not compulsory, but again, I do recommend them on public transport or on flights.
And what about the rugby game this weekend? Are they recommended?
Well, one of the things we do know is, and actually some very good research done in Japan on this, is that the risks for spread, particularly in the community, if there is COVID-19, are in places that are closed, that is indoors, crowded, and where there is close contact. Now, we've got two out of three of those, potentially this weekend, but people are outdoors, so the risk is a lot lower. And we're very confident, again, if people are symptomatic and they get tested at the moment, we're confident we haven't got community transmission.
How are you going to be cheering for this weekend?
Oh, it's a bit of a gimme, isn't it? I will be backing the All Blacks just in case there's any please.
On what date will the Ministry consider the Auckland August cluster closed? Obviously on the proviso there's no more community cases.
Yeah, so I think we sort of officially, and from we'll go for a 28-day period since the last case recovered, just to be really sure. But the important thing is to keep our testing numbers up. We want to maintain our testing numbers, and great to see over 6,000 tests processed yesterday. We want anyone with symptoms, wherever they are in the country, to be tested.
Was that the September 25 case, the last case that was recorded from the community?
Yes, that would be the last case. That was a close contact of one of the existing cases who was already in South.
Are they recovered now?
Yes, they are all recovered. All community cases are now recovered.
And when did they recover?
Well, we finalised that just yesterday, and that was announced by the Minister. That was when they were all considered recovered.
So it's 28 days from tomorrow?
It's 28 days from yesterday.
There's still a lot of chat around in terms of the high-risk countries